Very good evening to everyone. Sorry for my sexy voice a bit because towards the end of it, a lot of people are getting sick So I'm not the exception. So doctors also get sick So yeah, I'm recovering. Please bear with me with my this a bit hoarse and sexy voice for the next maybe 15 minutes. Yeah, I'll keep it very short. I'm a family physician. Of course, I just want to say that today again, thank you for the invitation from Eternal Clinics and Eternal Wellness to invite me to talk about menopause. Today, I'm just going to talk menopause, share some knowledge and insight about what I think about menopause. Of course, this doesn't represent Ministry of Health. Okay, so this is mainly on my point of view, but of course, I will tell you what sources that I've quoted for my references. Okay, so let's begin. The things I really like the topic of this menopause is not an ending, it's a recalibration. I think to start off the things, I think a lot of animals in this world, a lot of animals in this world, once they stop reproduce, actually they will die already. They will die. We as a human, and also the few mammals like the big whales, these kind of things, they still preserve their life after they menopause when they cannot reproduce anymore. I think that's a bit special, especially for us humans. Actually after we stop menopause, maybe at 50 plus like that. I think normal age Malaysian woman and Asian women is about 50 plus. Some now live up to like 70 plus, 80 plus, or even 100 plus. So some people will spend like one third of their life in menopause. And actually, what is the meaning of these of menopausal periods, right? So like you see, I think like animals, the most basic instinct is they need to reproduce. So you see, when they stop reproduce, they die. But of course, not like our human women. So they will spend about another 30 years maybe, in a menopausal period when not reproducing. So it tickle our minds that actually what these periods bring what meaning to us. Whatever you believe in. So I'm sure they are like whatever you believe in God or your creator or whatever you believe in Buddhism, Taoism or whatever. So there must be some meaning behind it lah. Personally, I think there's some meaning behind it. So we are going to discuss about like this menopausal, this transition period, how we go about it, how do we go, how we transform, or how do we recalibrate it to bring the other meaning of the last part of the life, right? I think that's what today what you're gonna talking about lah. Okay. This is my sharing outline. I will just simply say what's happened during menopause. What is the key symptoms that we have, when to get medical advice. And I think surrounding menopause, there's a lot of myths and also some facts, especially in the hormonal treatment of this menopause. And last but not least, I will just summarize it up. Then I hope that after that, if you all have problems, you have questions, you can always post in the chat or in the Q&A side. Or you're very shy, you can just like Dr. Stephanie said, to post it personally to the admin so that they can ask on behalf, so that is the thing lah. But of course, if you wish to get a full consultation, you can always contact Eternal Clinics for that lah. Okay, so we start. So what happened during menopause? So menopause is actually a natural and inevitable phase of woman's life, marking the end of reproductive years. So meaning that menopause is actually like we stop the menses, the menses stop, it means that you no longer reproduce lah. But of course, in the medical definition, it's a retrospective kind of thing. So you need to have menses absent for about 12 months before you are diagnosed to have this menopause. This is a biological process that occurs in most women, usually at 45 to 55 years lah. I think on average, Malaysian have about 50 or 51 like that when they get into menopause. So at this stage, our ovaries stop producing the hormones, like the main hormones is like estrogens and progestins, which bring about a lot of changes in the woman's lives, in their body, and also their state of minds. Okay. So some women may also experience this premature kind of menopause when they're undergoing like hysterectomy. Hysterectomy means that you take off your uterus, plus when you take out your uterus and you take out your ovaries also, you know. So this is what we call the surgical menopause. A woman will experience the menopause symptoms immediately after the operation, regardless of age. So if you like remove it at the age of maybe 30, you will start experience this all the menopausal symptoms at 30 years old lah. Okay. So next, I think menopausal symptoms is very wide variety. So there's a lot of symptoms, because I think like like let's say estrogens, estrogen they have receptors all over the body from head to toe. So you experience the symptoms from head to toe. So I think like everyone they will have a bit difference, I think just before like even before you start having stop even before you stop menses, a few years before that, maybe a woman will start experiencing, the body is not the same as the previous one. You can have like a lot of cases like they have like maybe unexplained headache, dizziness, then they wake up, headache, burning, then some they cannot sleep well, then weight is as catching up, even not eating much, then mood changes, the breast become tender, and also the private part become very dry, then of course as I said before, going to in the complete stop of menses, they will start to get some irregular menses, and maybe 2 months once, 3 months once, sometimes 4 months once, or after like 2 weeks they have it menses, then 2 weeks again they'll have menses again. So the irregular period, and of course memory problem, because our brain, our memory also very dependent on estrogens, right? So and of course they will have these hot flushes, night sweats, then start to have thinning of hair, dry skin, and also joint pains. Surprisingly, a lot of people they started to have a lot of joint pains in the morning. They have a stiffness, these kind of things. So there's wide variety. I just seen one patient just now in the morning itself, the symptom is mainly just like he told me she just like feeling, cannot concentrate, cannot concentrate, like our brain is very fogging, these kind of things. So and also cannot sleep well. Okay, so after we give some hormonal therapy, of course, go to exercise, eat well, the symptoms improved tremendously. She told me. So she started to find back, what is the meaning of life. If not, previously it's very, very irritable. All the family is having problem because, you become very irritable, easily get angry, easily get, how to say, trigger off. You trigger off like they will like scold the husband, scold the son, scold the children, scold the cats also even, so these kind of things it will happen during menses lah. Okay, so that's it. So when you get medical advice, it's very simple. It's actually when you have this kind of symptoms, is it bothering in our view, it bothering you and affecting your quality of life, then you should go for medical consult lah, so they can advise you properly lah. So or you have any irregular bleeding of the health conditions, right? Of course, they have, like I said, it's like too short, too heavy, you have blood clots, or you have less than 21 days, you have periods, or you have like before age of 45, you risky periods. This is prematurely lah, we will say. So when it's premature, you want to find out what's the reason behind it, or you bleed or spot. So in between period, you have bleedings, or after having sex you are bleeding. So that is all the things that warrant you to see a medical consultation lah. Okay, so the last part of it, I'm just gonna talk about some myths and facts. So I think this hormonal therapy is some things that I think scared a lot of women. When you talk about hormones, they're very, very scared. They'll tell you hormone will cause cancer. I think this is because of in 2002 big studies that saying that actually it causes cancer. It causes a panic button. You press on the panic button, everyone just get up, everyone just dumping their pills on the dustbin, on the toilet bowl, whatever. So, but after that, they review actually it is not. It is not. And of course, the preparation of estrogens, preparation of this progesterone is very differs. For now that what you are using and what they're using in the study is totally different now already. So it is it is not how to say, it is not one that causing breast cancer. Later, I will illustrate you. There's many other risk factors for breast cancer itself. Okay, so and also like if you have vaginal dryness, if you use the low dose of this kind of estrogens, actually it won't cause any breast cancer lah. Okay. Then of course the second one they'll tell you this menopausal hormonal therapy will cause blood clots. Actually they don't really increase the risk of heart attack if you started before the age of 60. And of course this hormone therapy may increase the risk of stroke throughout January, but the effect is very small. So it can be avoided if you have this kind of risk. Of course, we can always use the patches and also the gels or creams, that can reduce the risk. Huh? And of course, another thing is they say HRT causes blood clots. There is no actually increased risk of blood clots from the HRT patches or gels. Or for the tablet, yes, it causes a small risk. Okay, so the risk is very small. Okay, and HRT is dangerous. Okay, so actually HRT usually can help you to relieve all the menopausal symptoms, and it actually protect your bones and protects your heart if you started early. This is especially important if periods stop very early, like those that they stop the period at 30s, they need to remove the ovaries, So you need to start because if not, they are very prone to get this heart attack. So whenever you see like a lot of like women, they'll tell you after they stop getting menses, they start to have all sort of problems coming. Then you start to have like heart attack because like before you go into menopause, seldom you heard women's you get a heart attack. But after the menopause, the risk of heart attack is almost same as the male already because they have lost the protective effect of these estrogens lah. Oh, okay. So this is just I want to show you this onewomanhealth.com. They have comparison of what is the risk of having breast cancer because like when you are 50 to 55, you have this background risk. So when you age, of course your risk will be higher. So it's about in 2023 of people, even you are not taking HRT, you're not taking everything, you are at a risk of getting breast cancer. That's what we call background risk. Okay. So as you compare, you can see if you're using estrogen only hormone therapy, actually it reduces the event rather than increases the event. But of course, if you use the combined one, of course, it's slightly increased. It's about 27 over 1,000 compared to 23 over 1,000. Okay, so if you use like biosimilar, what we call bioidentical hormones, is actually the risk is similar as the background risk. Okay, so if you're very worried about getting breast cancer, I think you should look hard on like cutting down alcohol and also reducing your weight because that you see even like your BMI more than 30, your risk is like about double of the background risk. Okay, so actually the risk is much higher even than you're taking the pills. So even with taking the combined pill, the OO kind of pill is 27. Okay, so I think that is the thing that we need to explain to people. I think people don't understand. They just say, oh, it causes breast cancer. Yes, it increases the risk of breast cancer, but it's 27 cases over 1,000 versus 23 over 1,000. Okay, but if you're obese, your BMI more than 30, your your risk is you have a case of 47 over 1,000 as compared to 23 over 1,000. So it's almost the double, right? So I think this is the what we want to clear the myth lah. So and of course I think the HRT, they have other benefits like our bone strength, it protects the heart, and of course Curie will protects the brains, yeah, reduce the memory loss lah. So I'm going to finish with just few more myth and facts. So HRT actually causes weight gain. Actually, there's no evidence that causes weight gain, but it generally people is tendency to gain weight easily in the middle age. So a healthy exercise and healthy diet and also exercise is very important, which I think Coach Show will really touch on this later. So and a myth of like you need HRT. If you need HRT, you are beyond getting pregnant. Actually, HRT is not a contraception. So because contraception, you use the dosage a bit higher. So you need to contract contraception until the age of like really like go to see doctor say you're menopause, then because if not, you're taking HRT, but you still can get baby lah, something like that. So, and HRT only delays the inevitable. So, actually, HRT is effectively manages all the symptoms of menopause and lower dose of HRT actually continue to work when the women are older. Okay, so the thing is like I told you like just now the patient I see, initially the patients, the whole family is just getting chaotic, because of one menopausal woman at home, it caused chaotic, everyone is not happy, husband got scolded, son got scolded, cats got scolded, so but after, we shift out it really improved the quality of life, not only in that woman itself, but I think the whole household. I think that's what very important. You treat one person, but you treat the whole household. So, and HRT carries the same risk as pills. Actually, they contain the similar hormones, but those in HRT actually they are lesser. Okay, so they will deliver the different kind of ways, and so the effects may be not the same lah. The pills is mean the contraception pills lah. I think the overseas they always say the pills lah. So, and the last of this part of this natural methods to treat menopause are safer than HRT. But just because it's natural, it doesn't mean that it's a safe. Is safe. The study haven't been done quite enough lah. All the natural one. Okay. So, and I think a lot of study have shown that I think a lot of like even they have some studies about some herbs or whatever. HRT is still the one that most effective to reduce the symptom because HRT itself is what we normally produce in our body, the hormones that produce in our body. That's why when you replace back, of course, you will have a better effects, stronger effects lah. So when you are taking, especially the bioidentical, actually it's very safe. Okay, so you no need to worry that much that I will show you just now before. So that is the thing that we can consider lah if you're having problem. So and women stop having sex after menopause. Some do actually, some don't really lah. But of course, if like they stop mainly is because it's no longer that's very dry. So when you are having sex, it's very painful for women. So that's why the woman don't want to have sex, right? So but after your application some the estrogen cream, the woman will feel much better, more the place more moist, then it will easy for sexual intercourse. So so woman needs examination to make sure they can take HRT. Yeah, this is not necessary, but of course we wanted to at least check the blood pressure. And actually over the years of 40s, you should really do your anal check lah. Right, your anal car maintenance. This is our annual body maintenance. But it is not how to say, it is not a compelling needs to do the test to start the HRT, to be frank. There's no guideline to say so. And you only can take HRT for 5 years because I think the studies shown is 5 years. But of course, if you take longer, especially the medical one, it is actually safe if you take for very, very long time, until your age you die, right? So it's still okay, no problem. Okay. So I think in summaries, menopause in the transition phase in woman life, it's just there's a variety of symptoms you can present it with, you just get medical help. If that symptoms is bad enough to affecting your quality of life, and using menopausal hormonal therapy is very safe. Okay, with that, I conclude. I think my voice also it asked me to stop already lah. Okay, thanks a lot. Yeah.
Thank
Okay,
you,
over
Dr.
to you,
Liao.
Dr. Stephanie. Yeah.
Hi. Thank you, Dr. Liao. So it's safe to say that menopause does not stop us women. In fact, it is actually something that we should look at it as a new phase in life. And hormonal therapy is nothing to be afraid of. Of course, if you do choose to do a hormonal therapy, you can always do like bioidentical hormonal therapy. And if you want to find out more, of course, at Eternal Wellness and Clinic and Wellness, we do have this service. As Dr. Liao said, we always have to check before we administer any form of hormone or take any form of supplement. So everybody's body is different, and therefore it should be checked individually and personalized treatment. And I encourage everyone to always check with a health professional, a doctor, before being your own doctor, because sometimes taking the wrong dose or at the wrong time, it can cause the opposite effect of what we want. So without further ado, right, menopause can actually cause a lot of health or physical changes. in our muscles, in our joints, bones, so on and so forth. So sometimes we have been eating the same way we have been eating all the while, but suddenly you tend to, put on weight or even lose weight. So this is where we have our Mr. Coach, our Mr. Ho Ya Wen, who is a coach with over 20 years of experience, and I think he will be better at explaining how the body changes and what we should do, what sort of exercise we should do, because not everyone is uh, suitable to do cardio. Everybody's body is different. So let's listen to from Coach Ho. Coach Ho, to you.
All right, thank you very much. Let me maximize my screen so everybody can see better. Okay, hold on. Where's my mouse cursor? Okay, suddenly I'm losing my mouse cursor. Give me a moment. All right, try again. All right, okay. Okay, so hi everyone. It's me again. Thanks to Eternal Clinic and Wellness for inviting me for the third time to share my experience about health and fitness. And in this month's particular topic, menopause and weight gain is something that I can say I have dealt with a lot in the past few years because I run a health and fitness coaching business mainly online. And I can safely say more than 70% of my clients are female who are on the way to getting menopause, already in menopause, or in perimenopausal stage. So perhaps my opinion is very useful for them. So I don't need to go through a lot about my self. I think you have heard this before. I have a lot of experience in health and fitness coaching with engineering precision and some of certification. And I've so far trained hundreds of Malaysians from busy executive to stay-at-home moms. And I'm a book author, magazine and newspaper guest columnist, and also radio station guest. All right. So if you want to know more about me, we can visit my website, hoyafitness.com, or even look me up in Facebook. Look for my name, Hoya Wen, and you have a lot of information from what I write. So let's go straight to the topic. Right. So one of the that's a spelling mistake there. So that's one of the main issues as what Dr. Liao pointed out earlier in his sharing, right? Is a lady as she approached just menopausal age and eventually go through menopause. One of the issues that they don't enjoy, right? But they have to go through is actually putting on weight, right? And for some of them, and in fact, quite a lot of them, even though when they are younger, in their 20s, 30s, early 40s, they are not really that, have a lot of body fat. But eventually, as you reach the mid 40s to the 50s, 60s, then for no reason, a lot of fat accumulation happens, especially around the midsection of the body, right? Because the point here is that the female body do experience hormonal changes around this time, as the levels of estrogen, progesterone drops and stuff like that happen, right? So there seems to be a transition of body fat that usually accumulates at the lower half of the body, right? Female generally will accumulate body fat at lower half when they are younger, but towards menopausal age, it sort of like take the lift and go up to the midsection, to the belly area, to the love handles, which a lot of women don't enjoy, right? So actually, what happened? Is it because you're older now? Is it because your hormones are super imbalanced, or is it because your genes, right? Your genes that your mom passed to you. But before that, we need to define, like, how do you know that you are already in menopause? That means you stop having your monthly cycle for one whole year consecutively. If for one whole year and longer you don't have your normal cycle, then the doctor will do some investigation and assessment and sort of confirm that you are already in menopausal stage, right? This is their definition. So why the standard advice to menopausal ladies and females is not working, right? Let's look at just the top three that is always commonly heard. Number one is that, if you are accumulating body fat as you approach menopausal age, right, you gain a lot of weight, then generally people will say, hey, you need to eat a little bit less and start moving more, eat less and move more, right? Or people sometimes say that, oh, you are taking in too much calories and you're not burning enough, right? Now, this is a generic advice which I myself as a master coach will never give, right? This kind of advice actually will prevent further fat loss and causes more muscle loss. Now, in the previous two talks, I emphasized the importance of having enough muscle mass. And this is especially so for ladies as you approach menopausal age. Okay, very, very important because muscle mass not only prevent or slow down weight gain and fat gain, but it is also one of the best organs to protect your joints so that you can go through menopausal age safely with enough strength, right? One of the most common problems after a lady goes through menopause is osteoporosis, right? The bones become brittle once they have a fall, then their hips or knee and fracture, then you have to go for replacement surgery and things like that. So we want to prevent that. And one of the best insurance to prevent that is not to take a lot of calcium pills, but it's actually to build your muscle mass because the muscle is the organ that will protect the joint. All right. Now, the second common standard advice for menopausal ladies is, you should go on a low-fat diet because now you have a lot of body fat. Oh, low-fat diet. Well, that is also a myth. It's not necessarily suitable for all, and low-fat food and packaging usually is high in processed carbohydrates and sugars, right? If they take away the fat, then it really tastes like cardboard. So in order to make the food more tasty, more palatable, they have to replace the fats that they remove with something that tastes better. And in this case, it's usually higher processed carbs and sugars, right? Now, I'm not to say that low-fat diet is all bad. Some cases you do need a low-fat diet, but I would say generically not necessary, right? Because of these processed carbs and sugars. Now, when you add a lot of processed carbs and sugars into the food because you want to make it low fat, then that directly increases the insulin response in your body. And insulin is an anabolic hormone. It helps to maintain muscle mass to a certain degree, but excessive insulin over time will cause more body fat storage. And in this case, the body fat will store more at your belly and your love handle areas, which you don't like. All right. Now, the third generic advice is you should do more cardio or so-called old people exercise. Now, you can go and search what is old people exercise by yourself because there's so many of them, right? This is also bad advice, to be honest, right? Because if you do excessive cardio or exercise that, just a very simple light movement that don't really stimulate any muscle protein synthesis, it accelerate muscle loss. I just mentioned that muscle is the insurance for you to have a healthy aging, right? And if you do excessive cardio, especially at the 40s and above kind of like age, it increases oxidative stress. Oxidative stress is also one of the main reason of body fat accumulation. All right. So this is generic advice that is actually not working. In my world, in my coaching, I don't tell my clients to do such thing. Now let's look at the reality of the Malaysian menopausal female, right? Now, firstly, let's look at the food. What are they eating? Day in, day out, from breakfast till supper. Well, look at that. Teh tarik, the kueh, the roti canai, right? In fact, these are food that not just, females in their menopausal age eat. I mean, even very young people, even kids are eating that every day, which is not good, not optimal, right? Or they say that, you can eat everything lah, but eat everything in moderation. No, my friends, right? Now we have to be smart about our food. I'm not saying that you absolutely cannot eat this stuff forever. There is a place and time for everything. You need to be smart in picking up the right foods that you feel your body, right? In the past talk, I say a lot of people actually eat for entertainment. When they are bored, they eat. When they want to celebrate, they eat a lot. When they're sad, they eat. They're happy, they eat. They eat, eat everything, right? But eating everything in moderation is actually an excuse for I want to eat everything without uh, uh, being responsible for my own health, right? So if you do that all the time over a prolonged period of time, again, it is an insulin bomb, which will cause you to gain more fat and directly or indirectly, if I may say, increase the risk of heart disease. Right, like Dr. Liao just now do share, right? You don't have to worry so much about like whether the hormone replacement therapy will cause you, a heart disease and risk of cancer and stuff like that, right? In fact, you should be more worried in what you put inside your mouth every single day. Those are the things that increases the risk of your metabolic disease by a lot of factor, right, compared to hormone replacement therapy. Right? The second is that, the people, when they are a little bit older, then they always look for this kind of like food for older generation, food for aging population, or old people's milk formula and stuff like that. Right? Every time I look at those kind of food, I always laugh, right? For example, some special 3-in-1 oats, some special soy latte, low fat, high calcium milk and stuff like that, right? Now I can go on and on about all this stuff, but again, check the ingredients properly, right? Mother Nature, when they produce food in its natural form, there is no special category for natural food that is specific for old people one. No, food is food, regardless whether you're a kid, teenager, adult, or an older population. It does God does not differentiate food according to your age, right? Only human will produce processed food and claim that okay, this is specifically for older population or whatever it is, right? So, but again, the key point I'm trying to make here is that you need to check the ingredients properly. Learn how to read the food labels. A lot of people do not learn how to read food labels. They see the packaging, it looks very nice. It has the word heart health or low fat or low cholesterol, then they buy and consume. But please, right, the real magic happens when you read the ingredients properly. And if the ingredients is full of all the chemicals that you cannot even pronounce, then maybe you should think twice, right? Real natural foods do not need to have a special packaging. All right. Now, the third scenario, reality of Malaysian menopausal females is that, they claim that, I'm old already. I work so hard and now I'm retired. I just want to rest and relax more. Nothing wrong with that. Nothing wrong with that. However, if that is the only thing that you do, then your body will suffer loss of muscle mass by faster, right? It happens faster. And because of that, your body also suffering from lowered metabolism, right? Now, because of higher insulin, you are inactive, you are losing muscle mass. Because of all the hormonal changes, especially the drop of estrogen, progesterone, you're losing even more muscle mass. Then it is much, much, much easier for you to gain fat, especially around your midsection, your love handles, and even the upper back. You're gaining a lot of fat, right? The fat under the arms, the triceps there that a lot of ladies hate. Yes, all these things will happen because you are doing the same thing as most of the people are doing. They are not following, the optimal way of taking care of their health, right? Again, muscle is insurance for longevity and good health. Now, you may ask, oh no, Coach Ho, this is scary. So what should I do? What should I do? Well, here is what you can do. Number one, lift weights. When I say lift weights, I'm not asking you to go to the gym and put on 100 kilogram and start lifting weights. No, that is for powerlifting. That is for bodybuilders. if you are a menopausal lady, then your own body weight is also a weight, right? Lift yourself by doing squats, push-ups, lunges, and these are kind of like a few of those exercises that I always give to my clients that, you don't have to lift very, very heavy weight, but you need to be smart in choosing what's the right weight for you to lift, right? Now, if you want to learn more of that, of course, you can contact me on the site, right? Then I can guide you with whatever that is suitable for you. Now, lift weights doesn't mean that you only start lifting weights after you have menopause. No. Lifting weights should happen as early as possible. If you are in your late 20s, lift weights. If you are in your 30s right now, lift weights. 40s, lift weights. Because it takes time to build enough muscle mass. My dear ladies, it is impossible for you to look like Arnold Schwarzenegger just because you lift weights. It is impossible. Get that idea out of your head. It is impossible. I say that 3 times already. All right. So build enough muscle mass and strength to prevent fat gain. That is key. More muscle you have, less body fat you will gain. All right. You need to lift weights, build enough muscle, and with the muscle that is strong enough, your joints will be protected. Your bones will become stronger because you keep stimulating it with tension and weights and load with the proper movement and stuff like that. All right. From the dietary point of view, protein is king. 3 main macronutrients: protein, fats, and carbohydrates. Protein, in fact, the word protein comes from the Greek word proteos. Proteos is in English, it means first important. A long time ago, people already know the main macronutrient is protein. First important, right? Most females undereat protein. Undereat. Now, the target usually when I give to my clients is about 1.6 grams of protein per kilogram of your target body weight. Let's say right now you're like, let's say 100 kilograms. Okay, you're definitely obese and overweight. But then according to maybe the top end of the BMI calculation, you should be maybe 60 kilogram, let's say for examples. Then take 60 times 1.6 grams of protein. That should be your target daily protein consumption every day. So that works out about 90 to 100 grams of protein, which is equivalent to about 3 large servings of chicken breast, 4 to 5 eggs, fish, you consume that. Make that as a target every day, and it is non-negotiable. All right. Now, optimize your gut health. We talk about gut health in the first Eternal Clinic sharing. So go back and go to their YouTube and look at that discussion, right? So you must have the enough fiber. You make sure that your gut has enough digestive enzymes, probiotics. Identify your food intolerance. There's so many things you can do for your gut health, right? A lot of people do not realize that they are having trouble in losing body fat because their gut health is not optimal yet. Okay. Now, sleep. If you don't take care of your sleep when you're before you even reach into perimenopausal age, then as you reach into your late 40s and eventually go through the menopausal age, then you are suffering from sleep problems, right? Very hard to sleep, hot flushes and stuff like that. So learn how to have optimal sleep right now, before you get a menopause. Learn how to sleep properly. Go to bed early, right? Have a fixed, structured schedule every day. All right. Don't treat sleep as something that is optional. That last episode in Netflix can wait one. You don't have to watch everything. That email that you want to send can wait one. All right. I'm very sure there's a lot of things you can manage around your schedule, right? A lot of people say that tell me like, Coach Ho, I cannot sleep early. I'm so busy. I might have too much work to do. Now, let me tell you, my friends, right? People who are successful, right? They plan their schedule according to priority. People who are not successful in trying to regain their health and stuff like that, right? They usually plan their schedule according to how comfortable they feel, right? If you feel that your health, your issues that you're facing as you reach menopausal age is not that important, and your work and whatever stuff is more important, then maybe you should rethink what is your one thing that you should take care right now that is the highest priority. So for me, sleep is non-negotiable. Now, when it comes to supplementation, of course, there's a few general ones that I usually will advise my clients to take, right? Magnesium is very, very helpful, right? Especially it helps, there's already an association of magnesium and also estrogen and stuff like that. So you can talk to Eternal Clinic about that, right? Vitamin D3 and K2 is super, super important because in order to strengthen your bone strength and your brain health, right? Vitamin D3 is very, very good. K2 brings the calcium straight to the bone instead of staying in the arteries. K2 is very, very good. Look for the form that is MK7, which is awesome. Omega-3 comes from fatty fish, right? So take a lot of, you should have at least 3 servings of fish per week, at least, right? The minimum, right? If not, then you can consider taking supplementation of very high, good quality fish oil or krill oil, right? But I can go on and on, but if you are very serious in trying to address to prevent all these symptoms and issues related to menopause, or you're already in menopause and you want to address some of the issues you're facing, I highly recommend you to send a WhatsApp, pick up the phone, call Eternal Clinic, right? And tell them that, hey, I attended this talk by Dr. Liao and Coach Ho, and I have this problem. I'd like you to help me, right? So again, you don't have to come to the clinic in Penang. And now we are talking about digital medicine already. It's just a WhatsApp and you can have consultation here, regardless whether you're from Labuan, Sabah, Perlis, or Johor Bahru, anywhere, right? Just welcome to the modern era. So look for Dr. Stephanie, right? And you can get your consultation for specialized strategies and treatment, right? So again, remember, don't be the normal person. You must be optimal. Once you reach there, then I think you will have success. All right. So that's all I want to share, and I hope you enjoy and learn something.